Welcome to Real Talk with the Vagina Docs, where we break down the P's of pelvic health: pooping, peeing, pregnancy, postpartum, prolapse, pain, pleasure, and physical activity. I'm Dr. Jocelyn Conley, pelvic floor physical therapist.
And I'm Dr. Jordan, chiropractor and functional medicine expert, and together, we're the Vagina Docs.
Let's dive in. Let's welcome onto the show Alex Barr, owner of Dare to Birth. Alex, thank you so much for coming onto the show. How you doing this morning?
I'm so good. Thank you for having me.
It is my pleasure. Please, before we dive into today's conversation, tell us about yourself. How'd you get into doing what you do now?
I am a full spectrum doula. I've been a doula since 2020. I'm also a certified childbirth educator. I got that certification in 2021. I got into birth work just from how a lot of people get into birth work, my own experience with my pregnancy. I went through kind of like not like a very physically healthy pregnancy, but emotionally it was really rough. I faced a lot of discrimination from like the healthcare practitioners and things like that, and I had to navigate this really like world I had no experience in. I didn't know a single person who had a child and like sooner than like 30 years ago. I didn't know any, I was not prepared, and I didn't know how prepared I would have to become to get the experience that I wanted, kind of thing. So about halfway through my pregnancy, I decided to just like throw everything out the window and seek better care and seek more competent and compassionate care, because I was receiving the opposite. And through that, it kind of made me realize like, okay, a lot of people are probably experiencing this, and a lot of people are probably having a hard time like navigating all of this, especially if they're new to it, especially if there's not, I didn't have friends that had kids yet, right? I was the first one in the friend group to do that, the first one in the family to do that. And I just felt like there was such a gap in like what I needed, the support that I needed, right? So I decided like, okay, I could probably give that support to people. And so I dove right into doula work almost as soon as I had my son. And as I got into doula work, which I love being a doula, I just also saw the gap in like who can afford doulas, and right, and how can I give people support and care at like a level that's at a price level that's lower, right? So it's more accessible and more easy to access. And how can I help more people, right? Because as a doula, you tap out pretty quickly on like how many people you can support, right? But as an educator, I can do a lot more, right? So I kind of shifted my focus to education, and I started building this curriculum, and it grew into Dare to Birth. And now we have myself and 6 other educators, which is awesome. So being able to share like that with everybody has been really cool, and to see it grow, right? Especially, the new year just happened. So lots of reflection on like what's happened in the past year. And that's kind of where I am at now.
Very cool. So you and I have similar stories, but in our own respective domains of you diving into what you're doing because of your experience. I feel like I was the same way in regards to pelvic health and pelvic floor physical therapy. And the great thing about it is it does drive a lot of passion behind the work that you do. As you were sharing your story, I know that the listeners are going to be curious. You mentioned you faced discrimination in the healthcare system. Do you mind talking about that?
Yeah, of course. I have always been a plus size person, like my whole life. And I thought I was used to it when I walked into my first appointment with my OB. I guess I didn't expect it to the magnitude that I received it, because it was very, very like, we don't think you should be pregnant. Like, we don't recommend it. And I was already pregnant at this point. This is my first appointment. I'm excited. I was so ready to have this baby, and I was just met with so much like negativity. You shouldn't be pregnant. This is very dangerous. Here are all the risks, like running through first appointment. And first of all, like the main thing that affects your pregnancy is stress, right? On top of everything else. But stress is such an important thing. And to think that was my first interaction with my healthcare provider, and it just got worse, right? I was given information that I now know is not evidence-based. I was given information that was kind of skewed to scare me, like, oh, well, people with certain BMI have a higher stillbirth rate, right? And I asked, like, well, what can I do about that? And she said, nothing. Right. So it was just very much like there was nothing about like being proactive. There was nothing about how to be healthy in pregnancy. It was just very much like you're going to have all these things and you should be concerned about it, but I'm not going to give you any help or support on how to handle that. Right. You're probably going to have preeclampsia. You're probably going to have gestational diabetes. It was just like thing after thing after thing. And I was so taken off guard, like caught off guard, right? And that even followed when I decided to switch from like an OB's care to a midwife's care. A lot of birth centers in here and in other places have BMI limits. So if you have a certain BMI, they won't even talk to you. Like you can't even come in, like they won't check out your health or they won't do any testing or anything like that. They just absolutely will not take anybody over a certain like number. And I just felt like there was so much of like looking at me as a number and looking at me as like this piece of paper and not as a whole person, right? Like, what is my health? What is my activity level? What am I, what am I, how do I eat? How do I care for my body? That kind of thing. So again, being treated as a number and not like as a individual person with individual needs and individual health.
Jeez, your first visit where you're so excited and that's how you're treated. Now,
Yeah.
can I ask you, did any of the providers come, and you kind of implied this, but did any of them approach you with curiosity of like, what is your lifestyle like? These are what we're seeing objectively, but we know there's more to the story. So tell us a bit about your lifestyle, or they just throw out.
I will say that my experience is most providers don't care. Like they don't ask. And even I've had people ask where it's clear they didn't believe me, right? Like, so there was a lot of pushback at the time. I was like serving and bartending, and like I was on my feet for like 30 hours a week, walking, moving, lifting, right? Pretty active job, right?
Yeah,
Especially like compared to most
very
people.
physically
Yeah. Yeah.
demanding.
But I
Yes.
had providers who were like, "You need to move more. You need to move more. You need to move more." And I'm like, "More? Are you sure?" Like, I'm walking, I'm swimming, I'm also working still, but it just was like, "You need to do more. You need to do more. You need to eat less. You need to do more." Like very, blanket. They just give you blanket statements of like, "Oh, well, have you
Mhm.
tried not eating carbs?" Like just like the most random stuff without asking any of that background or trying or believing me when I'm like, no, I'm a very active person. I eat very like, the term healthy is relative, but like I eat very well for my body. I probably was at one of like the healthiest, like my body was at its healthiest when I became pregnant, right? I had done a lot of work to like balance hormones and I had like kind of dove into this like world of like alternative medicine kind of thing, but like it was I was at a point where I was very healthy and my pregnancy was very healthy, right? I had no complications, right? Which it's okay if people have complications, but I was already being treated as if I already had those things from the start, and I had to like double down and triple down, like, no, like I'm fine. Like this stress and this mental anguish is the problem, not my activity level or my lifestyle or things like that, right? But that's what, fat and plus size people face all the time. And any plus size person can tell you, like, that's the experience of every doctor visit. That's the experience of every like most people like that I've gone to see, right? Chiropractors and acupuncturists and things like that. They just want to give you this advice, which is like, I didn't ask for I didn't ask for that kind of thing, right? And thankfully, as I have dove further into the work and worked with other plus size people, there's a lot of evidence that's kind of on our side of like size doesn't equate health, right? And there's plenty of people who are in larger bodies that are perfectly healthy, right? And that it's not a one-to-one thing. So that was kind of the big light bulb moment for me when I started digging into that stuff of like all that stress and information that they gave me was like now becoming less evidence-based because we're getting more evidence that's pro, like your health and your isn't necessarily attached to your weight, right? And I also was like, okay, some of these things they told me were just to scare me, And again, if we're worried about stress and we're worried about like trying to mentally like make it through pregnancy, which is not fun for most people. It's difficult. It's hard on your body. It's hard on your soul, right? You're also like transitioning into this new life, right? And like if we're talking about that, then some of that stuff I didn't need to know, right? Like, or I needed to be presented in a different way, you know? So that's where it's like things like that, the more I dove into the education and the more I dove into the information, the more I was like very validated and like, first of all, plus size people have babies all the time, right? Like it's not like a crazy thing, but more validated in like that I was healthy and my body was healthy and my pregnancy was healthy, even if people didn't see that when they looked at me. Right. So that's kind of like that. I had to match that. And so I find a lot when I work with other plus size people, it's very much like I can't make all of their practitioners suddenly understand like all of that stuff that I just said, but I can make them understand that like your size doesn't have to define you and define your health and define like your experience, right? Like you have to know like some of these things that people will say, you're going to have to like throw them out, right? You're going to have to filter through what you need and what's important to you and what you think is right for you. And it's going to suck. So it's going to suck sometimes. So that's why I kind of call myself a little bit of an accidental like fat activist because I do it's something that ends up coming up a lot, right? And having those conversations about that. But it set the foundation for a lot of what I do and a lot of the way I like serve people and care for people of like, I'm never going to assume anything and I'm going to trust them and trust that they know what's right for them and their bodies.
One of the 4 agreements, don't make assumptions. Have you ever read that book?
Mm-mm.
It's a great book, but
Yeah.
as a healthcare professional myself, it's no matter what I see on people's history and intake, like I have to, and the first time I meet someone, I have to allow them to share their story and just be curious and not assume
Yeah.
like because they have X, Y, and Z in their medical history that it means something. And I'm afforded the opportunity to practice how I would want to be treated with
Yeah.
patience, with time. And I mean, I've chosen that for myself to step out of traditional healthcare systems and have my own
Yeah.
practice the way it is. But like the reality is most healthcare providers have maybe 10 minutes with a patient. And I think that is doing a lot more harm than good for a lot of people. And we were talking about plus size, and that the assumption is plus size is equates to all these health issues. And, in certain cases, they do have health issues at times if they're not living a healthy lifestyle. But I know so many plus size individuals who are plus size who are so healthy. They move well, they move in a good volume. But let's just bring up how many underweight or people who are obsessed with what their appearance looks like. And that does not matter what size you are, but women who
Yeah.
struggle with infertility because they exercise too much. Now,
Yeah.
that's not always the case, but
Yeah.
this is the first time I'm sharing this on the podcast. I'm officially prepping my body and my mind to be pregnant. I don't know the timeline, but I have a lot of mental health work that I need to do first. So that's my first focus. The second is if I were to try to get pregnant, like last year at this time, maybe not last year at this time, I just had knee surgery, but the year prior, I was so lean that I don't think I would have been in a healthy space to become pregnant and to have a healthy pregnancy and smooth delivery. And I know part of our practice is before pregnancy, getting people prepared to become pregnant from a nutritional side of their health, like healing their gut, opening up their abdominal wall, their pelvic floor. We know that what you do beforehand is so impactful during pregnancy. And I know for a fact I was not healthy. But if I stepped into an OB's office, they make these assumptions. Oh, you're fit and you're healthy. You probably shouldn't work out as much as you do. Maybe they would give me
Yeah.
that advice. I
Yeah.
know I'm very selective on who I have as my healthcare providers, but
Yeah. Yeah. And honestly, that you touched on a little bit of like preparing yourself mentally. And that is like, that's the thing that I see time and time again in classes and with my doula clients is there is now a big focus on preparing physically for pregnancy. Almost everybody forgets to prepare
and
mentally,
I think that
right?
is the most important
And
thing.
it's important for going through pregnancy and the changes that your body will go through. It's important for um, childbirth, right? Childbirth is a huge event. It's a big milestone in your life, and it's a big thing to not mentally prepare for it. And then postpartum, right? Like postpartum is so huge, such a huge shift, such a huge change. Your world is upended. Even if you've done it before, the second and the third time, still your life is different. And people are not prepared mentally for any of it. And that's something that I had done about for 2 years before I had my kid was go to therapy, right? And like that helped me work through so many things that made me realize I wanted to get pregnant. But I am so grateful for that and grateful for those tools and those skills that I learned because it helped me so much navigating this really difficult pregnancy. And again, it sucks that it was a difficult pregnancy because it was a perfectly healthy pregnancy. And if I'd had people who were compassionate and kind and like, yeah, you're good, right? Because, anyways, you can't tell me that I shouldn't be pregnant. I'm already pregnant. Like, that's such a loaded statement and such a terrible statement to say to somebody. But so it's just, but it's still like on my heart because I still remember how that felt. But if I didn't have those skills that I had gotten in therapy to navigate that or to go to the therapist and process that experience, I don't know what the outcome would have been or how I would have been able to navigate pregnancy and birth and postpartum. So like the mental aspect is so important and I think that a lot of people forget about that, right? Like I can teach you everything about like pregnancy and childbirth and what happens and what can happen and what can happen here and what can happen there, right? And you can probably teach people so much about their bodies and their anatomy. But if we're not mentally ready, your body has a lot of things that will interfere, right? Like there's so much that happens in birth that is mental, right? Like we need to like change locations or we need to turn off the lights or we need to kick somebody out and then somebody has a baby, right? Like it's all of these things where it's like we don't realize these emotional and mental blocks that are on us and on our bodies, right? Because we're not preparing for the mental. We're kind of like focused only on the physical, you know?
Exactly. When I think about if I were pregnant today, Alex, I get this overwhelming sense of, I mean, I am just not like whenever it comes to interruption of my routine, of being rigid about certain things, about not having enough time with Jordan, like I don't know how long it's going to take and I'm not, there's no I don't have to be perfect, but there's certainly I'm so grateful that I've committed to prepping my life mentally first because I see it every day. I see how my patients really struggle with the mental aspect of healing
Yeah.
and just their life is so different. And anyways, it it's sad that this isn't a regular conversation. Healthcare providers, our primary care providers, our gynecologists, or whomever is managing our well women's care, and even people who are leaders or influencers aren't saying, "Hey, let's get our mind and our heart healthy," and then everything kind of falls into place,
Yeah.
even the physical.
Because if you have the mental space to tackle that, right? Like, and I just like again, it's something that I try to help prepare for as much in my classes, and
Yeah,
it's a big topic of conversation of like, how do we mentally prepare for like your birth going like this like weird way and not the way you thought it was going to go, or like how do we navigate postpartum and have we had those conversations and what will we do if like something changes and we need to reevaluate, right? Like have we talked with our partners about the roles you want to have postpartum or like who takes care of what and have we like made plans on checking back in with ourselves like am I okay, right? Like how can I reconnect back to myself and make sure that I'm present and making sure that I'm caring for myself as well, right? Especially when we're talking about postpartum mood disorders and things like that, of like, how do we recognize that that's what's going on? Because the majority of people will tell you later on, like, oh, I realized that I had postpartum depression, or I realized I had postpartum OCD or anxiety or things like that. And it's like, imagine if we could have gotten you that help and support like in that moment, right? Instead of just having to suffer kind of on your own. And that's what I tell people when we talk about postpartum mood disorders is like, yeah, I can give you this percentage, like 20% of people have that, experience this, but it's probably a lot more, right? That's probably very underreported,
Absolutely.
right?
Absolutely.
Yeah.
You mentioned people saying hindsight. That's the problem. They don't necessarily recognize it when they're in the middle of it, and then they come out of it and they're like, "Oh my gosh, I wasn't even that. I was a different person." And I'll see that in my patients. I'm like, "Wow, you're in a totally different space now than you were at this point in time." And then
Yeah.
that's when they say that they were really struggling. And those are one of those questions that I ask. How are you mentally and emotionally? And a lot of people are not sure. Shifting gears. Well,
We
actually,
got down like a little bit of a
I
rabbit
know.
hole of, plus size pregnancy and things like that.
I want to know something, just another personal experience of yours is, were you intending to get pregnant, or were you actively trying to get pregnant, or was it
Yeah. Yeah. So I had
okay,
done a lot of work as far as like balancing my hormones, like eating at certain
that's
times of
right.
my cycles, getting my cycle very regular, being very intentional with my movement, that kind of thing. I just did a lot of like I guess, what is it, cycle syncing, right? I was doing some seed
Mhm.
cycling. I was doing some like this movement at this time, I was like temping, taking my temperature every day to see when I was ovulating. Like I was very in tune with that. So it was something that I was actively pursuing.
You mentioned you sought out counseling specifically to deal with stuff before the challenges of motherhood were
Well,
relevant in your
actually,
life.
I had started therapy just because I was having, I have just a history of mental health issues and, things like that, history of like manic depression and things like that. And I just had gotten to a point where I was like, I can't really handle this myself. And I started seeing a therapist. I had no intention of becoming a parent at that point. Um, but with my experience with working through with my therapist, I really like realized like, okay, some of the things that were holding me back from taking that step forward were really like past traumas and past like, issues with my own parents and things like that. And like processing that really opened my heart up and my soul up to like, okay, I think I could do this. And then I spent like almost a year like with my husband, like talking about what kind of parents he wanted to be and, like how we wanted to parent and how we wanted to live our lives and kind of just like working through that. I am such a type A person. I needed that, like, all that time to repair mentally and physically. But I'm grateful for that. I'm really grateful for that because I feel like that kept me a little bit grounded, in my pregnancy and now as a parent of like, okay, I knew kind of knew this was coming, right? So I definitely had that time to like, I'm the like research, decide what I want to do, research some more type of person. So that was really what fit with me. But that experience with therapy is kind of what made me realize like, oh, I think I do want to be a parent. And being a parent can be whatever I want it to be, right? And that's kind of what my issue was is I had seen like this is what being a parent is, this is what being a family is, this is what this looks like. And I didn't have like a lot of like great examples of those things, of relationships and family dynamics. So then once I got to the conclusion of like, oh, I get to kind of like make my own family and make my own rules, it really opened myself up. I opened myself to the possibility of like what my life could look like and what parenting could look like. And that's like, again, like I said, really been so helpful, especially as you navigate like having a newborn and then having a toddler and then now I have a 4-year-old and he's wild and full of life and love and like sunshine at all times. So it's definitely like that mental preparation was like so priceless for me because I probably wouldn't have even gotten pregnant otherwise, you know?
Hey listeners, if you're feeling frustrated with your sex life, whether it's due to pain, lack of pleasure, or just feeling disconnected from your body, we want you to know that you are not alone.
That's right. So many people struggle with these issues in silence, but it doesn't have to stay that way. We've created the Healing Intimacy program to help take you from pain to pleasure and restore confidence in your intimate life.
In this course, we dive deep into the physical, emotional, and even chemical factors that could be holding you back. And we'll give you the tools to transform your intimate experience.
If this resonates with you, head over to our website and join the waitlist. You'll be the first to know when the Healing Intimacy program launches, and you can take the first step toward a sex life that's not just pain-free, but pleasure-filled.
Visit www.vaginadocs.com to sign up for the waitlist today. Your pleasure matters, and it's time to reclaim it. You were one of the people who prepped, but unknowingly just starting with counseling, which is awesome.
Yeah.
So tell us a bit about Dare to Birth. What is Dare to Birth? What do you focus on in your work?
So Dare to Birth, I became a childbirth educator. I, went through training with birthing advocacy, which is where I am also trained as a doula through. And I felt like it really was very comprehensive and really set me up. And then I kind of had to decide, like, did I want to get trained under somebody else's curriculum, like some of the big ones like Lamaze or Bradley or other things, hypnobirthing. And as I just kind of dug into those, none of them really were my vibe. And they also weren't really aligned with some of the things I was seeing in, as a doula and with people who are having babies. So I really took that and kind of was like, okay, I guess I have to make my own curriculum. And I just started writing out, topics and ideas and things like that. And it just kind of grew over time. And as I taught it, I really saw more. I saw where I was missing, oh, I should have talked about this more. Or I saw where oh, I probably should have talked about that less, right? And I really just kind of over time teaching it, learning more, educating myself, the more I was at births and the more I was seeing, talking to families and stuff like that, the more that it shifted and helped shape the curriculum. So it's very advocacy focused, right? So I can't tell you everything that's going to happen in your birth, right? We know that birth is wild. We think it's going to be this way. We want it to be this way. And then everything is just thrown at you, right? And that was one of my experience at my birth, right? I had a lot of this is how it's going to go. And everything was thrown at me. But what I can do is I can prepare people to make that decision in the moment, right? I could say now that oh, I would never, ever get an epidural, ever. Never want it, don't want it, right? There might be a set of circumstances where you want that epidural, right? I could say that about a lot of things. I could say I would never, ever want a membrane sweep, right? But then there's some things that could come into play that might make me want that, right? Because a membrane sweep is an induction of labor, right, technique. But so you can never tell what the variables are that are going to be able to make the decision beforehand, right? So I really we do advocacy scenarios and kind of role play. Okay, if someone said this to you, how would you feel? What do you think you could say, right? Here's some things to think about, right? Really walking people through how to make those decisions in that moment, right? Because in that moment, you've probably forgotten half of what I taught you in class, which is totally okay, right? But can you remember oh, Alex said, or my educator said, I can ask this question. I can ask more questions. I have other options. Let's walk through okay, what are the benefits of this? Do I have other options, right? What if I say no? What happens if I decline that, right? So really making kind of giving the power back to people. You have the power to decline, delay, or consent to anything, right? So reminding people that they have that power. And a lot of people don't know. I think they either don't know that or they don't know how to do that, right? So a lot of people don't know, oh, I didn't know I could say no to that, right? But then there's also people who are I thought I didn't want to say yes to it, but I didn't think I had an option, right? So really hammering in what informed consent is, what it means to speak up for what you want, how to get more information in the moment. And then using that to make a decision, right? And then kind of walking through, what does that sound like, right? what does it
Mhm.
really sound like to say no to a provider or ask more questions or things like that? And like, how do we do it in a not scary way, you know? And so that's where like being at births has really helped me with education and teaching, because I have seen firsthand how to have those conversations and how to ask those questions and kind of slow down the room and things like that. So advocacy is the number one thing we really focus on. That's like our big focus. But then of course we also talk about all the other stuff, right? We talk about like what's the normal, what's a typical phases of childbirth and how does this go and how do we handle these situations? How do we prepare our bodies and our minds, for birth? What do we do in that moment when like everything goes to shit, right? Like, what do we do when like everything goes out the window, right? We talk about birth planning, and then the other thing that kind of I didn't see enough of was a focus on postpartum. So our entire third class is focused on like how do you prepare yourself for postpartum? How do you take care of yourself postpartum? What's going to happen to your body postpartum, right? Because that's really jarring for some people. And then, how do we take care of ourselves mentally? Things like how do we talk to our family and our support system about what we need postpartum, that kind of stuff. Because people really focus on birth, right? And birth is amazing and beautiful and it's important. That's like a day, maybe a couple days, right? If we're being honest, right? Postpartum's forever. You're a parent forever, right? Your body is different, your mind is different, your soul is different, right? And if we're not talking about that transition and we're not bringing, the reality to it of like, this is what happens, right? This is what happens to your body, right? This is why you need diapers, right? This is like all that kind of stuff. Diapers for yourself. I'll specify because you also need them for your baby. But, like really getting into the nitty gritty of like what that looks like and what that feels like and how to care for yourself is really so important. And so many people will tell you, like, I didn't know that I was going to bleed postpartum, or I didn't know that I was going to have contractions after I had my baby. I didn't know that I was going to, like, it was going to, like, pooping postpartum was going to be the worst. The first time I pooped postpartum was going to be awful. Like, there's so much of this stuff that we don't talk about and we don't share with, other parents, other pregnant people. Like, we're not like people aren't obviously not all people, but some people are, talking about pooping on Instagram. But most of the time that's not a topic, right? So it's not a topic of conversation. So you don't know what's normal. You don't know what's not normal, right? And it adds that element of shame of like, well, I'm just gonna like not talk about it, right? And it's like, this must just be me, right? But then you talk about it and people say, oh, I didn't know that was normal. I'm so glad, right? So it's really kind of demystifying some of that stuff.
What would you say to the person or people who would say, I got this. I don't need to take any classes. I'm just going to wing it.
I would say maybe you got it, right? But being more prepared, having more education really can help, because it's going to help you prepare for all of the different scenarios. So I have had, families come back to me and their birth went the total opposite way. And they say, like, I'm really glad that we took your class. And I'm really glad that we had an understanding of like what some of these interventions look like and things like that. And that's part of the things of like our curriculum. We really try to be trauma informed. And one of those things is preparing you for some of those things that can be scary, right? So a lot of that trauma and birth trauma comes from that surprise, that's like scariness of like, I didn't know that was going to happen. I didn't know what a cesarean would feel like or look like. I didn't like, right? And if that happens and you have the kind of like an understanding of like, oh, we covered this in class. It's still scary, right? But it's more manageable, right? So having people come back and be like, I'm so glad that we talked about that. And we were thinking about you while while we were giving birth because everything was going kind of crazy, right? We can never prepare for what's going to happen, right? But what tools can we take with us? What understanding, what support, what like hopefully even just a small bit of knowledge that I give to my students transfers and they can remember that of like, oh, I can ask this question, right? And having people say that to me of like, oh, we were thinking about you. Remember what Alex said, right? That is like such a like a big honor for for me to hear that. But my hope is that that helps a little bit of like, oh nope, actually I can ask for more questions. I can ask for what's on my birth plan. I can ask for, this extra thing to be done. I can ask for a more family-centered cesarean if a cesarean is happening, right? I can navigate all of these things, right? Because I can't change the outcome. Your doula can't change the outcome. You can't change the outcome, right? But what we can do is we can help with the outlook, right? So how we feel at the end, right? Yeah, maybe my birth went all these crazy ways. At the end of my birth, I was very confident that I made every decision that was right in that moment, right? So it was not what I planned. It was not what I expected. A lot of things went crazy, but every decision I made was truly my own. And I felt very empowered in that, right? So although I didn't get the birth that I was imagining and I was picturing, I felt very empowered in the fact that I had made all those choices on my own and they were the right decisions in those moments.
In order to make a decision, you have to have knowledge behind, whatever it is that you're making a decision on, and you're giving them it sounds like you're giving them the most direct knowledge to make informed decisions. And I could tell you, in the hospital, in medical offices, I do my best that my patients give me truly informed consents, but that's not the standard. They just have you sign papers and that's it. Versus like sitting down, this is what this means. You basically sign your rights away when you just blindly sign something. So anyways, I think,
or like the risks aren't fully explained, or they say, oh, there's no risk to this, right? I see that all the time. I have to be like, actually, there are some risks if you would like to talk about it, right? But the other thing I say is like, it's your right to have informed consent. It's your right to ask more questions. It's always your right, but it is your responsibility, right?
It is.
Because
no healthcare provider is going to wait and push you into taking responsibility.
Yeah.
I mean, I'd like to say I'm a compassionate healthcare provider, but at the end of the day, like, I cannot force you to do the work on your own end, on your end. You have to want it. So what's the difference between your class versus the class that a hospital includes in their birthing package?
Well, that really depends on like hospital to hospital, right? But a lot of times the hospital is going to prepare you to birth at the hospital, right? And I'm not saying that that's not valuable, right? But it could be lacking a lot of things. It could be lacking, how to advocate for ourselves, what our rights really are, right? How to speak up in those moments. It could be lacking in things like what your actual options are, right? Because there's a lot of stuff that happens in the hospital. They like everything to happen like in their process and their way on their timeline. And there's kind of like this like other side where it's like, actually, you don't have to do any of that if you don't want to, right? You are the patient, in that scenario, the customer, you're paying to be there, you're paying for their care, right? You get to determine that and you get to decide that. And, it's very much, what's the word I'm thinking of? I'm sorry. It's just, it's very much like, how can we get you to be the best patient, right? But you don't win an award for being the best patient. You don't win an award for being the person who asks for the least, right? And honestly, my clients who are in healthcare are the people who have the hardest time with this because they hate the idea that like someone would be talking like, oh my God, this person in that room. Like they hate that idea. But I really encourage people be that person. It doesn't matter. You're never going to see these people again, right? First of all. And it is your one birth with this one baby, with this one pregnancy, right? They're going to see maybe 4 or 5, 6 deliveries today, right? They're going to see hundreds in a year, right? This is your one that you get to make it special. You get to ask for everything. You get to hit the call button 100 times. You get to make sure everybody knows everything that's on your birth plan. You get to tell them like, hey, this doesn't feel right. Hey, I need more information. Hey, I have a question about this, right? It feels difficult to do that, right? And especially if you're someone who's like, I just want everybody to like me, right? And you don't have to be rude or mean to get what you want and ask for that informed consent, right? And I I encourage you, break up the standard, right? You don't want standard care. You want care that's tailored to you, right? And one of the ways to do that is to ask, right? And speak up and say what you need and say what you're feeling, right? And it's okay to like interrupt that. It's okay to be the patient who they have to come in and talk to more than they would like to, or the person that needs more support, right? That's okay, right? And a hospital birth class it might just be lacking in some of the nuances and some of your, like I said, your options. And again, your childbirth class really should talk about postpartum and what that looks like and how to prepare for that and what supports you can get postpartum as well as the birth, right? So a lot of classes will focus on birth as the main part, and then they'll touch a little bit on postpartum and they'll touch a little bit on newborn care. You need something that's going to be comprehensive, right? You need kind of all of that, right? I would also say that a lot of hospital classes that I've seen lack in like how to prepare for birth, right? So talking about preparing mentally, what physical activity can we do, right? Like how can we be moving our bodies? Why is that important? What can we be doing to open our pelvis, right? I'm a big spinning babies advocate. I love spinning babies, talking through that and what that looks like, right? All of that kind of stuff is sometimes missed, right? But I find that to be, again, more important, right? Like, how are we mentally preparing and how are we physically preparing? That's important, right? Because everything, like, not everybody is ready right away to give birth, right? And there might be some things that I can teach, and that definitely you all teach, that can actually help their bodies physically prepare, that a provider would never tell you or know or be even able to look for, right? So just things like that of like, who can you go for support? What practitioners can you see for that help and things like that? What are other options, right? You need something more comprehensive, in my opinion. Like, you need something that's going to be more tailored to you, and something that's going to be more comprehensive and more like give you the full breadth of like what this whole experience is going to be. And so like in our classes, we do meditations at the end of every class, we do journaling, like things like that, so that we're also preparing that mental side of it, as well as preparing for the physical.
I've heard from my patients that the classes they've taken through the hospitals that they were delivering basically oriented them to the hospitals and didn't really teach them anything. So what Alex and I are saying is, you're going to want to take additional classes to truly prepare for the before, the during, and the after. Now, let's say I have a lot of patients that are curious about hypnobirthing, and you and I have had conversations about the pros and the cons. Now, let's say they're already taking a hypnobirthing curriculum or some other curriculum. Is it worth their while to also take your class?
I'd say, yeah, for sure. There's no cap on the amount of information you need. And things like hypnobirthing, they're teaching a very specific like method. I can't teach you hypnobirthing, right? I can give you hypnobirthing tracks. I can give you meditations, right? I can talk about how we mentally prepare for it, right? But it's teaching something very specific. But I'd also say that, it really depends on who's teaching it. But sometimes there's gaps in what they're teaching, right? And the time that they have to teach it. And the big thing that I say with other classes is very much like, what happens if all that goes out the window, right? Are you prepared for when everything on your birth plan goes the opposite way, and everything in your mind of like how you're preparing for your birth goes the opposite way? Are you ready for that? And how will you take those tools with you, even if it goes this wonky route, right? And if the class you're taking isn't going to prepare you for that, and you can't take that along with you, then you should take other classes. You should have more information, get more skills, get more tools. And that's really my goal with our classes, is that hopefully you're leaving with those tools that no matter what happens, you take them with you, right? Your birth went the total opposite way, you still had those tools and those skills and that understanding of what you wanted and what was important, and that you can take with you.
Reviewing your curriculum, it was almost like I thought yours was like the foundational class that really everyone should have, in terms of how to be your own advocate, what to do when everything goes the opposite way that you wanted. And then if you really want to birth a certain way, that's the second layer. Like
Yeah,
hypnobirthing
and
is one of those, like you said, specific things, but if you don't
yeah.
know how to advocate, then it's really hard to execute that birthing plan.
And that's what I see a lot with people who are interested in hypnobirthing or have taken hypnobirthing classes. Sometimes it really quickly goes out the window, right? Or, there are some people who there's a lot of shame around the hospital. There's classes that I took when I was pregnant that was very much like hospital bad, don't go there. And I was like, well, I that's where I'm birthing. I don't, what do I do with that, right? Or like all interventions are bad, or, right? Like all of that kind of thing, without talking about the nuances of like sometimes this intervention prevents the bigger intervention, right? But nobody wants to talk about that. They want to talk about the cascade of interventions, right? Which is a real thing. But what about the intervention that stops you from going straight for a cesarean, or the membrane sweep that keeps you from getting, keeps you in your midwife's care, right? Because in Arizona, you have to transfer out of your midwife's care at 42 weeks, right? So what happens if you're 41 in a couple of days and you really want to stay with your midwife, right? You're probably going to be trying everything you can to get that baby that baby going, right? Or that labor going. So there's just so much nuance to it, and that's where I knew that I couldn't teach everybody all of the nuance, and I couldn't teach them all the like, you'll want this if this happens and this happens and this happens, right? But I could teach them this is what it is in a very non-judgmental way. Like, this is what this intervention is, this is what it entails, here are the benefits, here are the risks, right? In that moment, you get to decide, right? When someone's offering that to you, you get to ask those questions, work through in your brain, like, okay, do I need more information? Do I need less? Do I just know what I want to do? What is my intuition telling me? Right? How do I do that? Right? How do I work through that? And then from there, you get to decide, right? So again, it's very much like, how do I give this like non-judgmental information about all of these basics? And then you get to take that and do that with what you will. Right. And I would say our class is foundational, but I really, really I really tried to make it comprehensive, right? Like, it can be the only class you take, and you'll have the tools you need. Right. But it's definitely something where if people want to pursue things like hypnobirthing and things like that, I really go for it. Right. Anything that's going to prepare you and help you mentally, because mentally is that big part of it. Right. I say like the more education, the better in that sense, right? Especially if it's going to prepare you. But I do also caution some people of like, sometimes too much information does the opposite effect, right? And I really don't believe that like every person who's giving birth needs to become an expert in birth. And that's what I felt. I felt that like, oh, I had done this preparation and then everything went wild and crazy, right? But and I didn't like have all the information I needed, right? And so when I first gave birth, I was like, man, should I have done more preparation? Should I have done more education? But being on the other side of it as an educator, I just needed more non-judgmental education. I needed more education that was like, whatever decision you make will be the right decision, right? And very much like, here's what could happen, right? And here's why it might happen. And here's what you can do in that situation, right? I needed like just more, I don't know how to put it. Like, that's what I needed. And I think that's what a lot of people could use, right? It's just like, how do we prepare for your specific pregnancy and your specific birth and your specific thing, right? So really trying to make our classes very like, you can just take this one, right? You don't have to become an expert. We will give you the tools and the skills you need, and you can leave with that. But hopefully you can absolutely go down all of the routes of education and learn everything. I encourage people to do that if they're interested, but I don't think everybody wants to do that, right? And I don't think that you should have to become an expert to have good care, to receive good care. Um, but the reality is that's what often happens, right? Right? If you're not given the right skills and the right tools, then you have to become an expert to know, right? Like, to get that good care.
Right. So Alex is going to give you the tools, the foundations that you need to know, and the education you need to be your own advocate, which is ultimately the most important thing in the birthing process. So Alex, every guest that comes on the show, we've been asking, what would be one piece of advice to empower people in their pelvic health? What would you give?
I would find experts. I would find practitioners who will be compassionate, who will give you the full like rundown and support. There's so much support that people don't know that they have access to. And that goes for a lot of things, but there's so many people who are the experts that you can go to that will support you and will know exactly what to tell you. Right? I think a lot of people just sit and they say, "Oh, this is just how my body is," and the OB said I was fine, and there's nothing to really worry about or think about. But the reality is like that's not true at all. Like there are so many, and that's the thing that I've learned so much coming into this work. There is somebody who has that support and that education and that expertise that can help you. People just don't know it, right? So seek out those experts, seek out that support, right? Seek out Jocelyn, right? And Jordan, like seek out the people who are going to actually pay attention to your entire body and your entire person, right? Not just like one number or one statistic, right? So that's really my emphasis for like life is like find the people who are experts, but especially with pelvic health, right? Because pelvic health is not talked about enough. And it's not talked about in a way that like isn't like shameful and like whatever, right? Like I said, most people aren't getting on Instagram talking about pooping, right? But it is important, and we know that that's important, and it's a sign of our health and things like that, right? Or I think about how many people suffer with pelvic issues for their whole lives, and then it's just never a conversation, right? Get the support, seek out the expert. It will really, really make the difference.
Great advice. Find your team of compassionate providers. Alex, if people would like to take your class, where would you recommend they go?
Go to our website, daretobirth.com. We're also on Instagram at daretobirth, and just very like reach out if you need support or you need a class. We offer classes in person, we offer virtual classes, private classes, all the things, and hopefully we just continue to expand into more states and things like that. So we're obviously in Phoenix, but we'll also be in North Dakota and Missouri and Tucson next year. So, or this year, because it's already 2024. But
Yeah, Happy New Year. And,
yeah.
The class will be at the Vagina Docs office in North Central
Yay!
Phoenix. So
Yes.
we are super excited to offer the class here. So thank you so much for providing such valuable information today, Alex. And I look forward to having you on the show in the future. I look forward to future work with you. And if you have not followed Alex on Instagram, be sure to follow her. Her links will be on the show notes. And your Instagram is just Dare to Birth, right?
It's dare.to.birth.
Okay.
Yeah. So we'll put that in the notes.
Yes, absolutely. And then thank you again for coming on to the show. Until next time on Real Talk with the Vagina Docs.